Yeah, so the main reason that we did this retrospective study was because after TIL got approved in 2024, previously it was limited just to select centers, just done at the NCI, very specific patient population. And after it was approved in 2024 and, translated into a lot of bigger centers that hadn't done a lot of TIL before and into a real-world patient population, we saw that the toxicity burden was pretty distinct in real patients or real-world patients compared to patients who were in clinical trials or treated at the NCI. And what we really found that we struggled with the most was basically how to monitor people when they were discharged from the hospital, because most of the side effects that we know of with TIL, like the cytopenias, the fevers, happen when people are hospitalized, and they're in the hospital for about a week or two when they get the treatment, and then they're discharged. But we don't really know how to follow them when they leave the hospital, or understanding the burden of toxicity and things that happen when people are discharged. So that was the main kind of impetus behind us doing this project. What we found was that cytopenias persist for a long time after lymphodepleting chemotherapy and people getting Lifileucel. And there was a lot of lymphopenia, a lot of anemia, a lot of thrombocytopenia. We found when we looked at CD4 counts over time, about over 50% of patients hadn't recovered their CD4 count at 6 months after getting lymphodepleted before TIL. And then concordantly, we saw a lot of infections. So over a quarter of patients that we followed in our retrospective study had some type of infection. I think, interestingly, it wasn't a lot of opportunistic infections, but a lot of garden variety community acquired stuff, just at a higher volume than you would expect in an average cancer patient. And then we looked at things like autoimmune toxicities that can happen with TIL, like uveitis, vitiligo. We didn't really see a lot of it, and it was pretty mild. And then we looked at things like liver function abnormalities, rash. There wasn't a lot of that happened in patients. We looked basically at patients greater than or equal to 14 days after cell infusion. There wasn't a lot of organ dysfunction. There wasn't a lot of immune-related toxicity, but we saw a high amount of cytopenias and a lot of infections. And so our conclusion was basically that we're probably using too much chemotherapy to lymphodeplete people before TIL. And maybe if we adjust some of the regimen, it might help with safety of Lifileucel.